So Periwinkle is a company which is dedicated to making cervical cancer screening accessible to women from all walks of life. So we have developed a handheld device called the Smart Scope, which is usable in low resource settings, even at villages, rural areas, remote areas, where the lab infrastructures would not have been possible, right? Where women simply did not have access to such kind of tests. So we know that cervical cancer kills almost 350,000 women every year across the globe. And that's almost one woman dying every 1.7 minutes, which is really disheartening because this is a very preventable disease if it is detected in the early stages. So cervical cancer is predominantly caused by a virus called the human papilloma virus. And if it is detected in its early stages, the treatments are really very less expensive as well as less invasive. But unfortunately, because the symptoms are developed over a period of almost 5 to 7 years, women don't understand in the early days that they may be, having the symptoms because of the HPV. And that's why generally women come to the healthcare providers only in the very late stages when the cancer has metastasized, and therefore the death rate is very, very high for this particular cancer. If you look at the screening data itself, the World Health Organization has recommended that all women above the age of let's say 21 or 30 as per the country guidelines, basically women who are sexually active, should be screened every 3 to 5 years. But unfortunately, India specifically has less than 2% screening coverage. So less than 2% of the women who are in that age group. We understood that this is really a very, very hugely unaddressed disease area. We in fact met a few patients. We saw how they had to travel from rural areas to Tata Memorial Center. They used to sleep on the footpaths. I mean, this happens to all cancer patients, of course, but women especially undergo a huge amount of trauma once they are diagnosed with cancer, because not only do they have to suffer the pain of the disease and the subsequent treatment and everything, but they are also subjected to a lot of financial loss, because sometimes the family doesn't support them. Sometimes they also face abandonment issues. So it's really very disheartening to see them in that state. So we met those patients and we thought this is completely avoidable. If it's just such a simple thing as an early detection test, we could do something about it. And that's when we decided to completely focus on this. And there was like a small pivot at that point. So we decided to use the Net4Medics platform and turn it into a cervical cancer screening mission, so to say.